Hi, my name is Kurt Munoz. I'm Doctor of Physical Therapist here at Balance Physical Therapy. Today I want to talk to you about vertigo and vestibular rehab. A lot of people don't realize that physical therapists are actually experts in treating vertigo, and as well as balance and dizziness disorders. So I want to talk a little bit about vertigo. One of the most common forms of vertigo is BPPV. It stands for benign paroxysmal positional vertigo. And so what it means is it's non-harmful form of vertigo that happens when we change positions. So individuals who bend down to tie their shoe and they feel dizzy or like the world's spinning on them. Someone who lies in bed and they get dizzy, or rolls over in bed and they get dizzy, may have this form of vertigo, a positional vertigo. And what people don't understand is this: you don't have to live with this. Physical therapists specifically are well trained and informed in how to assess and treat positional vertigo. So everyone in their inner ear has a vestibular system. It's a system that works to tell us about how we're moving in space and about how we balance. So this is our vestibular system. It's showing here a series of semicircular canals that are normally filled with fluids. This would be in my inner ear and is about the size of a dime, so very small, and we would have one on each side. What it does, it tells me when I rotate or turn my head or body, the fluid glides over these little hair cells. The hair cells signal to the nerve and say, okay, I'm leaning back or I'm rotating right. Oftentimes we can have issues where other parts of the vestibular system have little crystals and they can migrate into these semicircular canals where it should only be fluid. When that happens, we can experience things like false sense of dizziness or spinning. And so, like I said, one of the most common complaints we get is when I'm in bed or lie down flat, I start to get dizzy. And this is where it would be a perfect time to come see a physical therapist. Let us evaluate you, see if you have positional vertigo. You don't have to live with it. We can take you through a series of positional tests to see if you have it and treat it within a few minutes and have you walking out the door feeling much better and able to live your life much more free to move and not be afraid of lying down. One of the most common forms of positional vertigo is when these little crystals get stuck in the posterior canal of the vestibular system. So a simple way to look for this and to accurately assess and diagnose it is to do what we call the Dix-Hallpike maneuver. What we do is we just have the patient sit comfortably. I simply rotate his head about 45 degrees and we get them in a comfortable position with their arm holding on to me so they feel safe. And then we steadily take them back into a lying position where their head is slightly extended and their eyes are open. From here, what I'm looking for is involuntary movement of his eyes. It's called nystagmus, and it tells us a little bit about what's going on with the inner ear and that positional vertigo. From here, if we see that involuntary movement, we take him through a series of rotational maneuvers to get that crystal out and helping him feel much better. So if we see that the patient gets dizzy or their eyes have that uncontrollable beat of their eyes, that nystagmus, we would simply take them through a positional maneuver to help them get those crystals out. So I want to demonstrate how quick and easy it can be. From here, we would rotate their head 90 degrees so they're looking 45 degrees to the other side. We'd stay here for about 30 seconds or to a minute, just depending on how much time they felt dizzy. From here, we would have him roll onto his left side by straightening your left leg. Roll onto your side. As you do that, tuck your chin towards the ground. From here, we would have him let his legs swing off and he'd sit on up, keeping his chin tight, slightly tucked towards his chest. And that would complete the maneuver. And we would retest to make sure that they felt nice and stable and without dizziness when they lied down after that. And really, that's all it takes to help you become more steady and without vertigo as you live your life. Thank you again for watching our video here on vestibular rehab and vertigo. My name again is Dr. Kurt Munoz, physical therapist here at Balance Physical Therapy, and I specialize in vestibular rehab and vertigo. If you're having any dizziness, please schedule an appointment and come see us, or visit us on our website at balancept.com. Thank you so much.